The next time you need a haircut, think of the barber shop with a grand tradition. Williams Barbershop. Williams Barbershop, proud to serve the entire community of Eufaula. Come by to our new location, new facilities, and see what it's like to be treated in style at Williams Barbershop in the old J.C. catalog store. There is another choice for making funeral arrangements. Central Funeral Services, located in Eufaula and Louisville, Alabama. With one-of-a-kind staff, thrives on professionalism and meeting the unique needs of families with a wide variety of services. Owned and operated by the Mixon family. Call 687-1060 or 266-5261. Melissa Mixon Smith, licensed funeral director. Welcome to Gumbo Live. I'm Ron Cassidy, sitting in today for L.C. Green, who's got some family emergencies that he's dealing with, and so we'll be doing the Gumbo Live today. We're in a different location. We're in one we haven't been in before, and we're up at Medical Center Barbour. And this is a great place to be doing an interview and some really wonderful people. I'm going to let them introduce themselves and tell you more about what they do, then we'll come back and do some question and answers.
My name is Jenny Strickland. I'm the Director of Marketing and Public Relations here at Medical Center Barbour. I've been here for 7 years. I also aid in physician recruitment, our volunteer program, and help chair the Medical Center Barbour Fund, our foundation efforts.
Okay. I'm Stephen Skeen. I'm the Chief Clinical Officer here. I've been in healthcare since 1986. I've been a nurse for 22 years. I've been at Medical Center Barbour since May, but I've been a Chief Nursing Officer for about 4 years. I provide clinical oversight and budgetary oversight for all of the clinical departments here at Medical Center Barbour.
I'm Ralph Clark. I've been here since 2007, and I joined Southeast Alabama Medical Center back in 2006 when we first started having conversations about operating this hospital. I am the administrator and chief executive officer, and I guess you could say the buck starts here.
Let's talk about something in general. We'll start with you. You mentioned the fact that you were in on the original negotiations to take over this hospital, and you've been here for quite a while now. What were some of the major goals that have been accomplished since this hospital has been under this administration?
Well, in the beginning, the facilities were in terrible shape, and it took probably close to $8 to $10 million to do a lot of the renovations and upgrades that needed to take place to get the facilities up to par, where we really could do the best work. And I would say that was the biggest thing starting out. We also dealt with trying to bring on staff. The company that was here prior to us had just about dwindled down the staff. So a lot of our people here were contract employees. Now we have no contract employees, and they're all employed from locally and full-time people. And I think the operations have turned around tremendously. We did add a few services, and they were no longer doing surgery at the time, so we brought a surgeon in and started doing surgery. The clinics that we have now did not exist, so we brought some specialty clinics. It was just primary care only, and it was difficult in the beginning, mainly because of the staffing issues. Of course, we had the building and facilities concerns that I had mentioned earlier, and we dealt with those, and that took about a year, probably maybe closer to 2 years, to do a lot of the renovations and bring things up to the standard that's expected in this day and age. So that was some of the major things we had to overcome initially.
What or who basically set standards that this hospital abides to? I know you have a board, I know, things like this.
Yeah, our Board of Trustees is the same board that operates Southeast, and so that's who we answer to. Outside them, we have to go by the standards that are set forth from the state. And we follow the state of Alabama standards for everything that we do, how we function, life safety issues that may arise, and they set those standards for us. So that's who guides us in the things that we have to do to be a quality facility.
Okay, let's go a little bit around the table. Tell us what you do.
Okay, like I said before, I provide day-to-day clinical oversight for all of the clinical areas. The largest portion of my job is nursing, which is, we have a medical floor, surgical floor, 5-bed ICU, we have a 7-bed ER, and we also have a 17-bed geriatric psych unit. But I also oversee laboratory functions, any of our internal, external lab functions that we have, radiology as well, which she'll talk about some services that we provide as well. But like you're talking about the quality and the standards, that's one of the things that I have to make sure that we're doing, and we're following all of those clinical standards that have been set forth for us.
I was over here visiting a few years ago, and you had just moved into the new ICU. And it was my first time to be there. I was amazed. This is an ICU that is on par with any facility I've been in, not in size, but in quality of that unit for this size, town. I just think you need to be commended for that. I want to talk a little bit about the type of ICU that's up there.
Okay. And I don't want to say basic ICU services. They can really handle anything up there. That with the hospitalists that we have, Dr. Gay and Dr. Serber, and some of the other nurse practitioners that we have on staff up there, we can take your basic heart rhythm type patients all the way up to a ventilator patient that has to be intubated and kept up on the unit.
And I know they do an excellent job, but I was just impressed with the overall quality of the equipment. From a layman's standpoint, looking in, that is an impressive unit.
Really is.
And the people that do there. All right, let's go a little bit closer here.
Okay.
All right, now tell us what you do here at the hospital.
Okay, my title is Director of Marketing, so I handle any of the marketing, whether it be radio, television, billboards, advertising. I handle all the advertisement for the hospital. I also handle all the public relations for the hospital, so that would be things within our community, within the chamber, with March of Dimes, with Relay for Life. I'm kind of the community point person for that. And also, 2 years ago, we started what is the Medical Center Barbour Fund, which is a subsidiary fund of the Southeast Alabama Medical Center Foundation, where we have been raising money to improve some of the technology that we have here. We were really excited last year to announce that we were able to purchase digital mammography here at our hospital, so we are able to offer that to the community, and that was our first big purchase of the Medical Center Barbour Fund. We are continuing to raise money. We've got our eyes now set on a new ultrasound machine, some new ultrasound equipment that can really benefit and expand some of the services that we already offer. I also handle the volunteer program that we have. If you've ever come in the hospital, you've probably noticed the pink ladies that sit at the front desk, and so I handle getting them situated and getting them oriented and overseeing the things that they do. I also help when Mr. Clark is looking for physicians, whether that be specialty physicians or new physicians to come into our community. I help in the recruitment process of those physicians, whether that be showing them around the town, getting them basic information on the community of Eufaula to try to recruit those physicians to our area. I also handle fun things too. Our employees, a lot of things with our employees. Every May we celebrate Hospital Week, so we have a week-long celebration of different things that we do with our employees for that week. I handle Thanksgiving for our employees, Employee Christmas. I help out with Nurses Week. This week's actually Radiology Week, so we'll be planning some things with all the people that work in radiology. So I have some really fun aspects of my job, being able to interact with the employees and really anything else that our administrator asked me to do is kind of the hat that I wear that day. So I have a fun job. Things always change, and I look forward to advertising the new services that we have to offer.
Well, I know that in different conversations we've had over the years, and in my experiences here at the hospital, that the services here, that the employee morale is tremendously improved over years ago. Just the general attitude from the time you walk in the door. If people haven't been here for quite a while, they're going to be surprised if they haven't.
Right.
This is not the same hospital that was here 15 years ago.
Right.
And that there's been so many changes. Radiology, we talked about. Intensive care. Emergency room over when I got here and now is just something to be amazed at. And with the way the staffing can react to problems. Occasionally there's helicopters landing here because of the needing trauma 1. And I know this from working with the fire department and their reporting. But it's just amazing that we have this kind of access. I sort of relate it to what I moved here from Nashville, and people said, well, you're going to have to go a long way to a movie theater if there's no movie theater. I said, well, 45 minutes to an hour. And they said, well, what did I tell you, a long way? I said, I always like to go to a theater on the other side of Nashville from where I live. It took me 45 minutes to an hour. So I said, it's just the same. And this is the point here. We have a good place for a point of contact. Kind of lead us through a little bit from a public relations side of what people can expect if they walk in the front door and need help.
Okay, well, I think one of the things that we've tried to embody over the past few years is just good old customer service. That's one thing. You know, we have expectations of our employees. We also have, you may not know this, but when patients leave our hospital, whether they've been an inpatient, whether they've been through the ER, or whether they've had an outpatient procedure, those patients can be selected to have a patient satisfaction call, which is basically a call that they get from a company that we contract with. And that company asks the patients anything from, you know, how were you greeted? Did the employee introduce themselves? Basically, it's good old-fashioned customer service. How were you treated when we were at the hospital? So one thing that we try to instill in all of our employees, and we have a vigorous orientation process where we teach basic customer service skills, is, you know, to treat that patient like you would want them treating your parent or your child or your grandparent. So one thing that I think that we're excelling in is that basic customer service, and that basic, you know, we are your hometown hospital, and we're going to take care of you like that we would take care of you if you were our neighbor. One, you know, other exciting thing that I've seen since I've been here is starting out with, for example, in our emergency room, we were seeing an average of about 9,000 to 10,000 patients a year, which is good for an emergency department our size. In the past, 7 years, I guess, they are seeing over 15,000 a year, which is great. And I think that says a lot for the service that these patients are getting, for the physicians that we have, that we have increased that much. And just in other areas, I can remember first starting to work here, and, you know, the census on third floor may have been 3 or 4, and you think, gosh, there's only 3 or 4 people in the hospital here. And since we've rolled out some new programs, we have, we may want to talk about the hospitalist program that we have here, which is basically we have physicians that are here dedicated to taking care of those patients that are in the ICU or that are on third floor. They're dedicated physicians. One group's here a week, and then the other group's here. So, you know, patients are getting familiar with these physicians and their faces. And so now, you know, we'll look at the census, and it could be that upstairs is full and we don't have any beds, which is awesome that people are putting their trust in us to come here. You know, radiology procedures, the one thing that I wish I could scream from the rooftops is that whether you have a CT scan done here in Eufaula or whether you drive to Flowers in Dothan and have a CT scan done, or Southeast in Dothan, the same radiologists are reading those reports. So I try to tell people, why don't save gas and stay here and keep it local, because the same physicians are reading those reports. Sometimes it's difficult to spread the word of all these good things that we're doing. I'll still run into people who are like, we have a hospital and you follow. So that's a little bit of a barrier sometimes, is getting the word out. But between our specialty clinics, we have a lot to offer. And Mr. Clark has always said, what we can take care of, we can do it just as good as anybody else. Now, granted, we're never going to be having heart surgeries here, or more than likely delivering any babies with OB program. But the things that we can do just as good as Southeast and Dothan, just as good as Flowers, just as good as anywhere in Columbus. And you better believe, if you come in, if there's something that we can't take care of, we will get you where you need to go.
One of the things, and I might go back to you and ask this, Mr. Clark, when you look at something she brought up, we hear on the street people talk about delivering babies, and there's really not the need for the facility that needs to back that up here in Eufaula. This isn't a bunch of babies being born every week. Tell us why that decision was made years ago. I know it's before it started here, but why it continues in place.
Well, it wasn't just our hospital. I mean, since I've been here, there have been 3 other hospitals in Alabama that have dropped their OB service, and it relates to payment and what the reimbursement is for the service that you're providing. If it was just to deliver a baby, that wouldn't be that difficult. But by the time you add a nursery and the staff to do a nursery, and then you add anesthesia services, because some babies are not going to be born naturally, they're going to be by cesarean section, and you add the staff to take care of that, and it becomes such that the reimbursement doesn't match what the work it takes, what the cost is to provide the service. And then on the tail end of that, it's the most libelous health care that you can provide. And so unless you have a large volume of patients and committed OB/GYN physicians, you just won't see a hospital this size providing that service. If I wanted to provide OB/GYN, I probably could not find a physician that would do it because of the risk that they take from the liability side. We have a physician that's here, and part of the reason he discontinued his service was because of that. Every time a child is born, of course the parents want a perfect child, and that's not always going to happen. And a lot of times it happens when the parent or the mother has received no prenatal care. We deliver them occasionally in the ER, and everybody's uptight when that happens.
Yeah.
But we've always had good success. And we get them delivered when we have to, and we get them transferred as soon as possible.
Right.
One of the things that we can enter into this, and it's not exactly the same, but it's close. I had a real good friend who was my personal doctor in East Tennessee back in the 60s, 70s. And he stopped doing surgery in Knoxville. His malpractice, he never had a malpractice, never had one. How much do you think that his malpractice insurance went down when he stopped doing surgery? It went down $27,500 a month. People don't realize that.
Yeah.
People say, well, the hospital deserves to be sued, this deserves to be sued. Somebody's paying for that at some
Absolutely.
point. They're paying for the attorneys, they're paying for whatever. You've got to pass it on. There's not some great big profit margin here. So kindly address that as to what hospitals are faced with.
Well, the biggest problem we've encountered is the reimbursement through Medicare. And in Medicaid, you could add Medicaid in with that, but it seems that our government doesn't think it's necessary to reimburse the hospital, and as it grows and as expenses are incurred, increase that reimbursement level. So I wish I had statistics I could give you, and off the top of my head, I just can't give you those, but I can give you examples. Where if you have a Medicare patient that comes in and we get paid a DRGA one set amount for no matter what we do for that patient. And I hate to put it, captain, in these terms, but if a patient comes in with a heart attack and we admit that patient and the patient passes away within the first day, within the first 24 hours, we make more money because we get that total DRG for that day, but we don't have to provide any more care. And so it's flawed. The reimbursement system is flawed. And so they're starting to look at that and trying to see if there are ways that we can change how we're reimbursed. But the governmental programs have not kept up with the expense side. And so our cost of hiring employees, buying goods and services and supplies, all those go up every year. But yet we've seen no increase in reimbursement from Medicare for, gosh, probably the last 5 or 6 years. And so we're losing now. And you'll probably find that a lot of small rural hospitals now are getting to the point where it's hard for them to make it based on the current reimbursement plans that are available. And then I won't get into the Obamacare and how that's changed things, but that's done nothing but reduce the reimbursement for healthcare providers. And in our situation, we've got a small group of primary care physicians, and a lot of those primary care physicians are limiting the number of Medicare and Medicaid patients they take into their practice just because of the reimbursement. It does not pay them enough to see the patient and provide the care. And I think that's going to hurt all small rural hospitals, not just us, but around the country.
One of the things that people look at is that they have all of these things hitting them from all different kinds of areas. Facebook, friends, organized groups or whatever. And they're continually talking about what a good business this is to be in a hospital. It's not a great business. This isn't something you do as an investment and go big time with it. And people don't realize that. Just the cost of physically maintaining this building is something else. Because take away that it's got to be maintained to state specifications.
Right.
Got to be certain amount of cleanliness involved here. Just an office building this size, the power bill,
Absolutely.
Yeah. The heat bill, all the different bills that you get. Water, I can't imagine. Even though you're located next door to the water board, I don't think you get a discount.
They don't cut our rates.
Not quite.
Just garbage, just everything you do costs money.
24/7.
Absolutely, yeah.
24/7. And I think that it's amazing that you and your staff here have put together such an excellent program here in Eufaula. And that people need to realize this. They need to look at it. Let's go back to you for a second, all right?
All right.
What can people do about helping with fundraising for this hospital?
Oh, wow. Lots.
That's another hour.
Yeah, there you go. But like I said earlier, that I guess it's been close to 3 years ago, I guess now, we started the Medical Center Barbour Fund, which basically we are a subsidiary fund of the Southeast Alabama Medical Center Foundation. Got that started because we saw a need. We saw that our hospital was viable and that we're going to be here for the long haul. It saw a need for new equipment, for new technology, ways that we can enhance our services to our community. And so we sat down and we've got a board for our Medical Center Barbour Fund. We've got about 12 members or so board, and we look at different fundraising events. We've done various things. We've had I guess 2 holiday parties where it's been of a fundraiser kind of gala where we've had silent auction. We just got finished back in September. We did our 2nd annual golf tournament, which we raised over $30,000, which is really good for a golf tournament, and so we were really excited about that. We have several big events planned each year that bring in a lot of money. We also get donations from our community. We've had such a good support from our community of coming and partnering with us and sending in checks and wanting to be a part of what we have. We've got, if you get a chance to look at, we've got a donor wall that's in our radiology department in the hallway. And it's so humbling to go and look and see the long list of names from business industries that have partnered with us to help almost, all of our employees are members of our fund. They give to our fund. We're actually right now in the middle of our employee campaign, which is a 2-week long process where we present all of our information to our employees and give them the opportunity to donate back, whether through payroll deduction or one-time donations. And the amazing thing that maybe I shouldn't say is we usually end up with a larger percentage of participation from our employees than even the employees at Southeast. So I think it goes to show you that our employees really buy into what we're doing here and want to improve our hospital. And like I said, with the support, we were able to purchase digital mammography, and now we are looking at and getting pretty close to some new ultrasound equipment. So, anybody, we accept donations that can be in honor and memory of someone. Usually once a year, we'll send out patient letters to patients to see if they wanted to honor an employee through a financial donation or a physician through a financial donation. So we are open to any fundraising ideas, any fundraising opportunities so that we can enhance the quality of healthcare that we offer.
Well, I know that any time that you've got these, let us know at the TV and
Okay.
radio, because
Okay.
we'll help you.
Great. Yeah.
We're not just here to make money. We're here to help people that are helping you fall.
Okay.
And one of the things, and we'll move back to you for a second, that when you look at the way this hospital helps you fall, you look at the fact that businesses that look at coming here, we've got a major plant coming to town. I know that when Steve Harvey was looking at this and his people, that they looked at this facility. They had to. They had to look at it. Can we get the support we need? Give an example of how we support with this hospital getting new industry.
Well, if you go out and try to recruit new industry, they always want to know about 3 things. And those 3 things are transportation, education, and healthcare. And it's so important when you're talking to an industry leader about coming to your community, about the services that are provided at your local hospital. It's like Jenny said earlier, we're never going to be offer brain surgery or open heart surgery or things like that. So we want to make sure that we do the basic things. And if somebody has a problem, they can come here and get the care that they need. And if we cannot provide that care, then we're going to make sure you get to the right place. And I could give you example after example of times where that's occurred, where people have, and a good friend of mine who had a heart attack and he came here, and he just sings our praises because he probably wouldn't have made it if he had tried to travel to a facility 40 miles away having his heart attack. So we were able to stabilize him and get him where he needed to be, and where he really survived. And he has been so pleased with that. And I think as a business and industry looks at a location, that's one of the things they want to know. If their employees get hurt on a job, how accessible is it to health care? If they bring their family members here, they're going to be health care available for their wife and their children, for those services that we can provide. And if we can't, then we make sure that we get you somewhere that can provide the level of care that you need. And so as you do business, and I've been on recruitment tours with the chamber before, and they always want to know about the health care in the community. And so if the community is going to stay viable and going to grow, I think the health care is one of the 3 main things that has to be available for a community to thrive.
Looking back into your area, your administration ability in working with these different departments that you do, that takes a degree of really commitment, because you've got somebody, you don't know who's gonna come in that door to the emergency room. You don't know. You don't know what of your facilities are going to be needed, personnel or whatever. Your people have to make some instantaneous decisions. You want to talk about that a little bit?
It starts with hiring quality staff, and that's one thing that we try to do on a daily basis. Any openings that we may have is hiring somebody that's going to be as dedicated to this place as we are. Making sure that they have the educational background plus continuing education to stay on top of the types of issues that you're talking about. And that's what the community wants to know as well, is that we are putting quality personnel in all of these departments that we're talking about. And then every year we have like an annual skills fair for all the different departments, continuing education qualifications that they have to have every year. We're singing the praises of Jennifer Bryan. She's our education coordinator. And making sure that they continue those standards on a daily basis. So any of the issues and stuff that we have come up, especially like through our satisfaction surveys and things like that, is staying on top of those to make sure that we're going to provide that quality care every day. So when I have my clinical manager meetings, I always tell them, I said, we have to do 100% customer service 100% of the time. You know, you can't really have a bad day. In our jobs here, you may want to have a bad day, but you really can't, because we know those people that are coming here need us every day.
I know one of the things that amazes me about this facility, because I cover news. And when I do, a lot of that news ends up coming up here because the person got transported here. Mm-hmm. I have been here several times, not just once, when this place couldn't hold any more people, wow, even in the parking lot. Your staff does such a good job of handling those situations without letting them get out of control. And you need to be commended for that. What is the biggest thing people who are coming in here to see a loved one who's been involved in an accident, had a heart attack, whatever? What kinds of protocols should they keep in their mind?
One of the biggest issues, because I know family wants to be at the bedside. They really do. They love their family members. We love them as well, and we want to provide top-notch quality service to their family member. So understanding that we have to do things with your family member that do not need to be interrupted. Because it's easy to get distracted enough when you have a situation going on like heart attacks and strokes, traumas. All of the stuff you hear on the news like you're talking about does end up in our ER, and it can be chaotic. So understanding that if you want that type of care, we need to have hands on your family member without the interruptions. So we will keep you as informed as we can when the situation arises or lets us do that, take a break from taking care of your family member. We will let you know what's going on. So communicating through the registration people up front and letting them know that you're here, you're available to receive information or give information if it's needed, and we'll let you know when that time comes. So it's really important for us to have really uninterrupted service for your family member. And that's tough, I said, because there's a lot of tough situations out there, a lot of heartbreaking situations out there, but that is very important for that staff to be able to do that. And understanding that in those situations it's very stressful for the staff because they want a good outcome for your family member. So in your daily life, sometimes your stress level can be elevated and you may be a little short. We don't want to do that, but some things can happen. But let's just understand and be as patient with us as we can be as patient with you.
And the people, if they would designate a person to come up here to get information and then have a common place on Facebook or something to post it, it would be so helpful to this facility.
It really would.
When you get 400 or 500 people around this facility and somebody else has an emergency, it's hard to get in here. You know.
And using my family as an example, there's 7 of me and my brothers and sisters and 45 grandchildren. You know, so when grandma's sick, we all want to know.
Yeah.
So we understand. We usually pick the eldest person that's there of my brothers and sisters, and they disseminate the information to everybody else as it is, because we have a very large family, and That happens here, especially in rural farm communities.
Yeah, and that's one of the things we have to emphasize here. This is such a close-knit
Absolutely.
family here in Eufaula. And that if everybody converges that knows somebody
Right.
who's been in an accident, it really makes it difficult for the hospital to do its job.
Absolutely.
Because you're trying to deal with three things besides what you need to be dealing with. And I think that if people keep this in mind, if they utilize the media that's available to them now, I know there's HIPAA restrictions on information you can disseminate. Let's go a little bit with that. I know you know something about it from a public relations standpoint.
Absolutely, yeah, you can't tell anything. And basically, yeah, you can't, that is why it makes it difficult if there's 300 people in the parking lot. Because we do have, it's the law to protect that patient's privacy, and it's that patient, sometimes family members, sometimes I can't even find out information about my mom because it's her HIPAA, it'd be a HIPAA violation. So I mean, yeah, that's our one of our top priorities is keeping that patient's record confidential. Our whole staff goes through extensive HIPAA training, and we know, and that's been something, because I know back in the day, I like I said before, I'm over our volunteers, and it's been a little struggle sometimes with them, because back a long time ago, before HIPAA came out, they could go share with their preacher at church who all was in the hospital. And so now it's, we've got to keep this information private, we've got to respect their wishes. So yeah, it makes it difficult when you've got the parking lot crowded with people to maintain that sense of privacy. And also, like you said, if we have another, motor vehicle accident and we need patients that need to come in and get treatment. But, knock on wood, we really haven't had too many of the bad cases in a long time where we've just been overrun with people in our parking lot. It's happened a few times, but we've got such a good relationship with the city and the Eufaula Police Department and the fire department that they are always willing to come in and help us with any situation.
Traffic control.
Absolutely. Absolutely. Yeah.
And talking on the HIPAA, and you're talking about your mother or some of your elders, one things parents don't understand is after your child becomes of age and they can sign for themselves, we can no longer give that parent this information, even though that's their baby. And so we have to withhold information and give it directly to the patient and let them disseminate the information how they want to, because that is very tough to sit there and tell a mother that their 18-year-old or 19-year-old child, that is still their baby, that we can't tell you anything about them, and they become upset, and the staff has to deal with that.
I was amazed when I got started in radio. I was still in high school and working one summer in Lenore City, Tennessee, about 30 miles outside of Knoxville. And one of the first things I had to do, and I never heard of this in Knoxville, was I had to call the local hospital and the three big hospitals in Knoxville and talk to a person who read me, who was from Loudoun County, that was in the hospital, and what their condition was, their name, what church they attended. I mean, and I just seen this whole thing with HIPAA come up, and it's so different.
It is.
And anybody that can remember those days and remember that reporting goes, well, why can't they do that anymore?
Right.
And one of the things that we bring up in press with the city every week, we have 2 press conferences, is we have little times where we talk about how things have changed. And these are not decisions that this facility has made. You didn't make a decision to do this. You didn't make a decision. You did. These are decisions that are made much higher up.
Absolutely.
And I'm not talking about the state level either.
Right.
These
and
are federal.
there are really hefty fines that go along with
Fines, jail time.
absolutely.
Yeah.
It's serious business. It's very serious business.
And I guarantee you that your people know that.
Absolutely.
They
Yeah.
receive that education frequently.
All the time, yeah.
One of the things that you deal with here, and sometimes people don't think about this that much, this hospital is staffed 24 hours a day, 7 days a week, no matter what the holiday is. The commitment level for these people to have to give up their life like this
That was different when I worked in television in bigger markets, and I volunteered for the overtime to work in television. But this is beyond that. This doesn't require somebody to volunteer necessarily. It's just part of the schedule.
Absolutely.
And that's some part of the people here don't ever think about these people and their commitment here. That you're giving this community such service. You're giving them the ability to have 24-hour-a-day care. And when they go inside this emergency room, you're dealing with the fact that they've got to make an instantaneous decision. Can we treat this person here, or can we treat them at another facility? And not always is it even Dothan. You'll get things that have to go directly to even a larger hospital than Dothan. We're lucky that we have the level of commitment in Alabama to hospital care. And we're lucky that we have a facility like this that follows that level of commitment. Give me an example of how your staff handles when somebody has to be medevaced. How quick is that decision made?
It's pretty quick, depending on the situation. Like Mr. Clark said a while ago, we have a good group of physicians that we've employed here through a group called Southland. Dr. Paul Hart and his group, Dr. Tony Gabelson in the ERs, he's our ER medical director. But sometimes it can be minutes. They can recognize what's going on with that patient depending on how stable they are when they come in. Fortunately, most of those situations come in by ambulance, but there are times when family members will drive their loved one up here without calling 911 and present us with a case that we do have to make some immediate decisions. But there's a whole host of tests that we can run, but it starts with the physical assessment that the nurse and the physician do when that patient arrives in the facility. So even when they come to the registration door and talk to the registration clerk out there, they know some buzzwords, chest pains, stroke, weakness, and all these types of things like that they can pick up on to get that patient back as quickly as possible. So it can be seconds to knowing what we need to do for that patient. But we always make sure that they're as stable as possible before we can transport them, or we just have to keep them here until we can do that to get them to the next level of care. And talking about some of the other services that have been brought in here is telemedicine. Trying to do things in small rural hospitals to give you access to different types of care like neurology. So when your patient does have a stroke here, we can do telemedicine like a camera, where we have a neurologist from Dothan or Atlanta that can see that patient with a high-powered camera and do what we call a physician-assisted assessment for that patient. So he can recognize and give us a second opinion on what's going on with that patient, so we can administer clot-busting drugs here for a patient that's having an ischemic stroke. And then if they still need to be transported to the next level of care, we can do that. Heart attack patients.
Yeah, we just had that happen.
Just had that happen.
Yeah.
So Ms. Clark's talking about a heart attack victim that comes here. We have the clot-busting drugs that can be administered here. So they'll do the EKG and run the lab tests and all the stuff that's necessary to identify those things and see if it's appropriate to give those types of medications. And the whole time, a lot of stuff is going on simultaneously. Registrations calling another consulting physician. The nurses are calling and setting up and giving a report for lifeline services. While this patient is being taken care of, we're waiting for results and that patient's being stabilized. So it happens pretty quick here. And I wish I had the numbers in front of me as far as our ER waiting times and throughput times, because that's another measure that Medicare looks at for us, even in the emergency room, is how quickly you're getting patients from the time they sign in until the time they're discharged out of our door.
think
and we're below national average.
We are below. I
wish
think
knew the
we're
exact
right at
number.
around 2 hours, maybe just
Yeah.
a little over 2 hours. I know we're under 2.5 and over 2 a little bit. And basically what that is the wait time, as if when a patient signs in, like Stephen
Right.
said, when they sign in to wait to see the physician, and then when they leave, our average wait time is right at 2 hours, maybe at 2 hours and 15 minutes, something like that, which is amazing. You know, you hear of stories of people waiting in the ER
6, 7,
elsewhere
8
for
hours.
8 hours all day.
And that's in big cities.
Absolutely,
Right, yeah.
absolutely.
Supposed to
So,
have
you
an
know,
abundant
and
resource.
we have, which our ER department probably wanted to kill me back a few years ago, we had a marketing program where we had on the digital billboard in town our average ER wait time. So, you know, you could drive by and see that the average wait time right at that, you know, moment was 10 minutes, 15 minutes, 30 minutes. And one other big thing is we like to tell people, I know that there are people that probably wait in RER more than 2 hours. Probably somebody watching this is saying, oh, I was there for 4 hours last week. That is an average wait time. And also another important thing we want people to consider is that if they by chance are in RER for something non-emergent, you know, maybe they've got a cold, maybe, you know, stomach virus, and they wait longer than they think is necessary. One thing we really want to keep in mind is our triage process, and that, you know, if a patient comes in with chest pain, then obviously we're going to have to cycle that patient in, and they're going to have to be seen before a non-emergent case. Or, you know, sometimes we'll have people in the ER waiting room that may be upset because they've been there for a long time, but they haven't heard that there was a motor vehicle accident on the 4 lane, and we've got 3 ambulances backed up to the bay. So we really try to have communication with our registration clerks, letting them know that, hey, you know, we've had 3 ambulances come up, we're going to get to you as quick as we can. But just so people know, you know, if they do come in with something non-emergent, that if an emergency comes in, that is going to be treated first.
And it would really help if people could go to see a doctor when they've just got something minor. This is a hospital.
Yeah.
It's not a quick care unit
Absolutely.
for just a cold.
Well, and one thing that we did to try to help out with that is right beside our ER, right behind the room we're in, we opened, about a year ago, the Family Care Clinic. So what the Family Care Clinic is, it is a walk-in clinic. They can take appointments, they can take walk-ins. It is staffed with a nurse practitioner. One of our ER physicians is her collaborating physician, so he oversees her patients. She is open Monday through Thursday from 8 to 4:30, and on Fridays from 8 to 12. And we're accepting new patients. So, you know, that is one thing that we realized with our ER being flooded with such non-emergent cases, is that if we had somewhere that we could send those patients to. A lot of the physicians in Eufaula weren't accepting any more new patients, and even if we had a patient up on 3rd floor that we needed to discharge and they obviously needed follow-up care, a lot of those patients didn't have physicians. And, you know, we couldn't get them in with any of the physicians in town because they weren't accepting new patients. And those patients needed follow-up care, you know, to help them with their medication, to help them with their disease progression, education in their disease. And so that was another way of kind of helping those patients that needed a physician, was opening up this clinic that we have back here. So we like to advertise that's an option, you know, for non-emergent care, is that we've got this clinic right beside the ER. You can just walk right over.
And there's a clinic too.
Absolutely, absolutely. And we opened a few months ago, we've got a clinic that is over on 617 East Broad Street. It is beside Dr. Bush. Jennifer Fortson is our nurse practitioner in that clinic. Dr. Bush is her collaborating physician, so he oversees her charts. So we opened up that clinic. So really in Eufaula, we've got 2 clinics, 2 that can accept walk-ins, that are accepting new patients. And then we have one that we've had, for 6 years now, in Louisville. Jonna Cotton is our nurse practitioner. We've got a rural health clinic that's located in Louisville. So we've got 3 locations in our county that are all 3 accepting new patients. So we're happy to offer that service.
Let's stay on this just for a moment more. If somebody listening right now,
Okay.
and they say, okay, I need to go to the doctor, don't have a doctor, how can they take advantage of these clinics that you're telling us?
They can drive and come to any of these 3 clinics and walk in. They can make an appointment if they want to. We've got all the phone numbers advertised, and I have them
Okay.
so each of them accepts walk-ins, so they can call and schedule an appointment, or they can just drive over and be seen and be seen.
I want you to get those numbers, because we're going to get them
Okay.
before we go off
Absolutely.
today.
I will. Okay.
We're going to do that.
Okay,
All
you
right.
want me to go ahead and do it?
Do it, all right.
Okay,
Yes.
our Family Care Clinic, which is the clinic located right beside our emergency department on the campus of Medical Center Barbour, is 334-688-7410. So 688-7410. You Follow Family Practice, which is the clinic located beside Dr. Bush's office on Broad Street. Their number is 334-232-7816. And then the clinic in Louisville is 334-266-5110.
All right, let's go over them again.
Okay.
Let's just get them, I want them to write these numbers down.
Yeah, write these
and their
numbers down. I
and
wrote
their
one down.
location.
Okay, absolutely. The Family Care Clinic, this is the one that is on site here at the hospital, is 688-7410. You Follow Family Practice, which is located on Broad Street past the post office beside Dr. Bush, is 334-232-7816. And then the Family Care Clinic in Louisville is 334-266-5110.
Okay, that's very good.
Yeah.
And they can call the hospital and get the numbers
Absolutely,
anytime.
absolutely.
And location.
Yeah.
So let's keep that in mind.
Absolutely.
One of the things that I want to make an offer to you here,
Okay.
and I probably just like your boss does, and I'm not his boss. Mark is my guy that works with me. He's a good friend. I want to make an offer to you.
Okay,
We've got a live radio show in the mornings
okay,
on 96.5.
okay,
I want you to, we're going to give you a number
okay,
today, and you can call anytime you want to in those morning hours and talk to Mark and just tell him what's going on.
Okay.
If it's fundraising, if it's something to do with care, if it's a new announcement to make, whatever. That is no charge. We're not going to charge for this.
okay,
It's just going to be for local information,
okay.
Public service.
public service.
Yeah.
Because there's a fine line here between this is a facility that does take in money, and a lot of it, but it doesn't keep it.
Right.
This isn't a high profit margin facility. This is something that if we work together, we can see it grow, we can see it built, we can see it promoted.
Right.
I'm going to get to you now, and then I'm going to go to you with the same type question. How do you recruit for people? Where do you look for people to work in these different departments?
Woo. We really look to some of the local colleges around
Okay.
here. Sparks campus here that's in Eufaula Wallace College. Wallace College in Dothan. I did a career fair just last month down in Troy. We try to reach out to the Columbus area. There's a Miller Mott Community College up there, Columbus State University up there. This whole surrounding area that I try to pull staff from. And it's extremely competitive because we are a small rural facility, but we're competing with Dothan and Auburn, Opelika, Columbus, Phoenix City. People drive to Montgomery for jobs like that. But so we try to offer a small town environment for these people, but they can still get the same type of exposure to a lot of the different things that they could in some of these other places. So if you're not participating in the open heart surgeries and the brain surgeries and stuff, we still do the same type of care and provide the same type of education here at this facility as they do at those other places. But they have to want to come and be dedicated to a small rural environment, providing the type of care that we're looking for. So we do some newspaper advertisement, but I like doing the face-to-face meetings with students, with other people looking for jobs out in the field myself. I still participate in those. I still come to work in scrubs. I haven't converted to the shirt and tie because I am a clinical person by trade. I really enjoy the hands-on care, and that's the type of environment I want these people to know that they're coming into.
I want to move over to you.
Can we plug
yeah.
that we do have positions available so
Oh,
that
you
if
should.
anybody is watching, we have LPN and RN positions available. We've also have, I believe there's a registration clerk, which is a business office position, administrative assistant position, a PRN radiology tech position, and I think we've got an environmental services position. So we are usually hiring some sort of position. We have got these positions posted on our website. They can come up to the hospital, fill out an application online, or come up to the hospital and pick up an application from the pink ladies at the front desk.
And for the nursing staff, because a lot of people have gone away from using LPNs, I still utilize LPNs here at this facility. I even cross-train them to work in some of our higher acuity locations like our emergency room and our critical care unit. Because a lot of people don't realize that there's a whole scope of practice that the Board of Nursing lets them operate under that you can latch on to and utilize those services as well and provide some opportunities for them. I encourage those LPNs to go back and go be a registered nurse and still come back here and fill some of these other positions we have. But we run the gamut of services here, emergency room, the medical surgical floor, the critical care unit, our inpatient rehab unit, which is like, we call it swing bed, but it's like doing inpatient rehab at like a nursing facility, or not quite Health South, but like a Health South type inpatient facility. And we have a geriatric psych unit if you're interested in doing mental health with patients that are 55 and older. So a whole range of services that nurses have opportunities to train into here.
One of the things that I want to mention, because
surgery.
I had a real good friend who was a nurse. In fact, she passed away several months ago. But at that point, she looked at coming here and going to work. She worked in Southern California. Sure, the money was 3 times what she would make here. And she came here and looked. And she said, I just make so much more money. I said, well, let me ask you a question. I said, how much do you pay for a place to stay?
Absolutely. Cost
And
of
she
living.
was renting a room for about $1,400 a month.
Yeah.
It's all relevant.
It's all relevant.
Absolutely.
And I will say that the pay scale you have here at this facility is on par with the cost of living in this area. You want to speak to that?
Yeah, and we do that every year. We do surveys and we want to be competitive with other hospitals and other facilities. It's hard to compete with, even with our local nursing home, because it's a different type of care. And the reimbursement scheme is quite different. And our employees that have been with us for a while are very dedicated employees, because we've gone years and just here recently that we hadn't had the money to give raises. And so they're working for the same hourly rate that they may have worked for 4 years. We were fortunate last year, we were able to give a bonus because we had a good year. And so if we have a good year, we take the profits and we share that with employees. And so that's what they have to be willing to accept, is being able to work with a group of people that are dedicated to healthcare. And you consider yourself serving your community by providing healthcare. And so it's a difficult task. The other difficult part is how do we employ physicians, or how do we get physicians to come here? And that has become more and more difficult, because right now we're in a huge shortage of physicians. I was in a meeting last week, and Southeast currently is recruiting 40 physicians. We need 4.
Yeah.
But primary care physicians, and that's why we open the clinics, because we can provide health care, we can provide good level of health care as well through our nurse practitioners, and they're supervised by well-trained, well-qualified physicians. But people have to be willing to accept that, and we're currently trying to recruit now. And we deal with all the factors we've gone over today. Is, we've got to latch onto a physician who likes to hunt, fish, live in a small community. That's easy. Finding that physician is easy. The hard part is getting his wife to like
Yeah.
the amenities and things that you find in a small town like Eufaula, and be satisfied with school systems. And that's the difficult thing. I mean, I talk to physicians just about every week, and I can sell the physician if he's an outdoorsman. But when his wife gets on the internet and she checks us out and finds out where the nearest shopping is, all of a sudden he don't even want to come back and visit anymore.
Yeah.
And so that's what we have to deal with. It just has to be the right fit.
Absolutely.
And we are constantly trying to recruit. We recruit through several recruiters, through a state program, and through many sources out there, and Junie helps with that. Through a state program called 3RNet now, and they send us a list, usually on a monthly basis, of the physicians that are coming out of programs and may be interested in a small town. We can't wait for the school to graduate their first students out of residency at Southeast Alabama Medical Center at ACOM. And they're just late for us. We need them now. But in 3 or 4 years, they'll be available for us, and it'll be much easier. But that was the whole idea about creating that school, is because there's such a shortage in Alabama. But you can go anywhere in Alabama and put your finger on that town, and I guarantee you they need physicians.
Yeah.
And it's probably that way all around the country.
One of the things, when we sat down, and we were preliminary talking, you said, we can't talk for an hour. Well, we've done it.
Let me guess. But I still have so much more that I want to talk about.
So much.
Well, we're gonna do some more.
Okay.
And whether it's LC Green's program or one we develop especially, we'll offer him the opportunity first.
All right.
But we appreciate the fact that you invited us in.
Well, we appreciate you coming.
Well, we're glad to be here. We're here to help this community. And I'm here right now, Ron Cassidy for LC Green, and the program's name is Gumbo Live.
The next time you need a haircut, think of the barber shop with a grand tradition. Williams Barber Shop. Williams Barber Shop, proud to serve the entire community of Eufaula. Come by to our new location, new facilities, and see what it's like to be treated in style at Williams Barber Shop in the old JCPenney catalog store. There is another choice for making funeral arrangements. Central Funeral Services, located in Eufaula and Louisville, Alabama. With one-of-a-kind staff, thrives on professionalism and meeting the unique needs of families with a wide variety of services. Owned and operated by the Mixon family. Call 687-1060 or 266-5261. Melissa Mixon Smith, licensed funeral director.